Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about dealing with and managing constipation after your knee replacement surgery. Hi everyone, so we're talking today about constipation. Obviously not a fun topic to talk about, but something that can be very prevalent and kind of really cause some problems and pain and discomfort, particularly after any type of surgery, including knee replacement surgery. So what are some of the causes? Why do you potentially get constipated more frequently, more commonly after a surgery? Some of the things to think about is, one, you're probably taking some sort of narcotics, pain medicine, one of the side effects being constipation. You are recovering from having anesthesia during your surgery, which can cause some constipation. Your body is in a state of inflammation from healing and recovering from the knee surgery. You may have some electrolyte imbalances, some fluid imbalances that you're dealing with, which of course can cause constipation. And you might be a little bit inactive or have some dietary changes early on after surgery as well. So all these things kind of can combine and really increase your risk of having constipation after surgery. So what can you do to treat this and to manage it? Well, one, you want to really try to get moving early on. Of course, there's a ton of benefits and a ton of things, very important reasons why you want to move and get moving and walking and doing all your exercises early on after surgery. And just to add to that list, it's going to help with constipation. It's going to help with moving your bowels, moving your everything in your digestive system. You also want to stay hydrated. We talked about this in a video earlier this week, but the importance of staying hydrated early on and throughout your recovery after surgery. You want to try your best, not always possible, but try your best to wean yourself with the doctor's help and coaching, wean yourself off of your narcotics and pain medicines in a timely fashion. Obviously, everyone's going to have different experience with pain, and their narcotics might be necessary to help manage the pain effectively. But if you're able to wean yourself off of those medications, obviously one of the side effects is potentially constipation. So if you can stop taking those medicines, then you're going to reduce the potential of that side effect. Also, you want to try to increase, make some dietary changes, so increasing your fiber intake can be very important, as well as trying to avoid certain types of food or excessive amounts of certain foods, such as dairy products and processed foods. Of course, a very important thing, also a way to manage it, is taking a stool softener. So you can, kind of the first line of defense would be an over-the-counter brand. And then, of course, if you're really having some difficulties and struggling, your doctor, your surgeon can prescribe you a prescription medication to help manage your stool and for stool softener techniques. So that's kind of the main ways to help manage and help treat any type of constipation that you're experiencing after knee replacement surgery. So I'd love to hear if you have any other techniques, any other strategies that you can share with the group, share with all of us. Of course, I think some people will find it very helpful and be very thankful. So thank you very much for watching, everyone. As always, please subscribe. Check us out online, kneereplacementtherapist.com. Thank you very much. And